There's one vitamin your blood vessels may be starving for right now, and if your levels are low, your blood pressure may stay high no matter how healthy you think you're eating. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share science-backed health tips like this every single day. Over the years, one pattern keeps showing up again and again. People focus on salt, stress, and pills, but they miss one simple deficiency hiding in plain sight. And when that deficiency sticks around, the body starts acting like a car driving with the parking brake half on, the heart works harder, the blood vessels get tighter, the pressure creeps up. Today, I'm going to show you why vitamin D matters for blood pressure, who it actually helps most, and how to use it the smart way. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think high blood pressure is only about salt, or only about weight, or only about age. But blood pressure is more like a kitchen recipe. If one ingredient is missing, the whole dish turns out wrong. Vitamin D is one of those ingredients, especially after 60, when you spend less time in the sun, absorb less from food, and often take more medications. And here's the shocking part. Johns Hopkins has noted that about 40% of adults in the US are deficient in vitamin D. That means millions of people may be walking around with a hidden problem that affects far more than bone health. Surprised? Most people are. They hear vitamin D and think bones. Not blood vessels, not blood pressure, not the heart working overtime. Let me be clear, I'm not telling you to throw away your medication, not pills versus nutrition, but pills plus fixing what your body may be missing. In fact, a 2022 study from the Medical University of RAAS found that vitamin D did not significantly lower 24-hour blood pressure for everyone across the board. That matters. Why? Because it tells you this is not magic. It's not a lottery ticket. It works best in the right person, at the right level, in the right dose. That's why this conversation matters so much. Not everybody needs the same fix, but if you are older, low in vitamin D, carrying extra weight, or already dealing with hypertension, you may be in the group that benefits the most. So let's break this down simply. Number 5, it's not just a bone vitamin. Most people think vitamin D is only for avoiding weak bones, but actually it also acts like a traffic cop for blood vessel tension. When vitamin D is too low, signals in the body can get messy. One of those systems is called RAAS. That's just a long medical name for the body's pressure control system. Think of it like a faucet. When the faucet is turned up too high, pressure rises. Vitamin D helps keep that faucet from running wild. Your blood vessels are not hard pipes. They are living tissue. They squeeze, they relax, they respond to hormones. When vitamin D is low, those signals can push the body toward tighter vessels and higher pressure. It's a bit like trying to water a garden with a kinked hose. The pump has to work harder because the pathway is too tight. A 2024 analysis from Nicolaus Copernicus University found that in older adults, vitamin D supplementation at 2,000 IU a day was linked to a 1.3 millimeter Hg reduction in systolic blood pressure compared with placebo. That may sound small, but blood pressure changes often work like interest on a savings account. Small changes repeated every day can add up over months and years. So what do you do with that? First, stop thinking of vitamin D as an extra. Think of it as a foundation nutrient. Second, look at your daily routine honestly. Are you indoors most of the day? Do you wear long sleeves outside? Do you skip fish, eggs, and fortified foods? If yes, your intake may be lower than you think. The easiest food step is to start with real sources. According to the NIH, 3 ounces of cooked sockeye salmon gives about 570 IU. 3 ounces of farmed rainbow trout gives about 645 IU. 1 cup of fortified milk gives about 120 IU. 1 cup of fortified soy, almond, or oat milk gives about 100 to 144 IU. 1 large scrambled egg gives about 44 IU. Half a cup of UV-exposed mushrooms gives about 366 IU. See the pattern? Not a random salad, but targeted foods. A simple routine could look like this. Salmon at lunch twice a week, fortified milk or fortified plant milk with breakfast daily, eggs 3 or 4 mornings a week, mushrooms added to an omelet or soup. Not perfect, but consistent. And consistency beats intensity every time, but wait until you see number 4. Number 4, the real issue may be deficiency, not dosage. Most people think more vitamin D is always better, but actually the bigger question is whether you are low to begin with. That's the part almost nobody talks about. If your tank is already full, pouring in more doesn't help. But if your tank is nearly empty, even a small refill can matter. A 2024 study from Zhongshan Hospital affiliated to Xiamen University looked at 139 older adults with hypertension and osteoporosis, with a mean age of 73. The researchers found something very interesting. When vitamin D levels were below 42 nmol/L, every small rise in vitamin D was linked to about a 1.4 millimeter Hg drop in 24-hour systolic blood pressure and a 1.1 millimeter Hg drop in nighttime systolic pressure. Once levels got above that threshold, the link was no longer significant. That means the benefit may be strongest when you are truly low, not when you are kind of healthy, not when you are guessing, but when your levels are clearly below where they should be. Isn't that a huge difference? So here's the practical move. Ask your doctor for a 25-hydroxy vitamin D blood test. That's the common test used to check your level. Don't guess. Don't supplement blindly for 6 months and hope for the best. Get the number, write it down, recheck it later. And while you wait for testing, build your base safely with food and sunlight habits. Try 15 to 20 minutes of outdoor light on arms and face a few times a week if your doctor says that's safe for your skin. Go in the morning or late afternoon if the heat is too much. Sit on the porch, walk around the block, water the plants. You don't need a beach vacation, you need a repeatable habit. Quick question. Have you experienced morning headaches, dizziness, or that pounding feeling in your chest? Comment yes or no below. Now let's talk food again, because this is where people overcomplicate things. 1 tablespoon of cod liver oil has about 1,360 IU, but that can be too much for some people if they're also taking a supplement, so don't stack things carelessly. 1 serving of salmon plus fortified milk plus an egg may already move you in the right direction. Not more products, but a smarter plan, but wait until you see number 3. Number 3, you probably don't need a mega dose. Most people think a huge dose works faster, but actually more is not always better. This is where people get into trouble. They hear a vitamin can help, and suddenly they want the strongest bottle on the shelf. That's like using a fire hose to water a houseplant. A 2024 randomized trial from the American University of Beirut Medical Center studied 221 older people with obesity who took either 600 IU a day or 3,750 IU a day for 1 year. Here's what happened. Overall systolic blood pressure dropped by 3.5 millimeter Hg, and diastolic pressure dropped by 2.8 millimeter Hg. But the higher dose did not provide extra blood pressure benefits over the standard dose. That's a big lesson. The same study found that people with obesity and people with lower vitamin D levels seemed to benefit the most. So again, this is not about taking the biggest dose. It's about matching the dose to your body and your need. Not extreme, but effective. Here's the thing. For adults over 70, the NIH says the recommended daily amount is 800 IU. The upper daily limit for most adults is 4,000 IU from all sources unless your doctor tells you otherwise. That means your supplement, your fortified foods, and your cod liver oil all count together. Many people forget that. So how do you do this in real life? Start by checking the label on everything you already take. Your multivitamin may already have 1,000 IU. Your calcium pill may also contain vitamin D. Your fortified milk adds more. If you pile all of that together without looking, you may overshoot. A simple method works best. Pick one main source. Either use a modest supplement your doctor approves, or build around food first if your level is only slightly low. Pair it with a meal that has some fat like eggs, yogurt, or fish. Because vitamin D is fat soluble, that just means your body absorbs it better with food than on an empty stomach. One easy day could look like this. Breakfast with fortified oatmeal or cereal and milk. Lunch with tuna or eggs. Dinner with salmon and mushrooms. If you add a supplement, take it with your biggest meal. Then stop there. No doubling, no random extra capsules because you missed a day. But wait until you see number 2. Number 2, it works best as a missing piece, not a magic cure. Most people think vitamin D should replace blood pressure medication, but actually it makes more sense as support. Think of medication like a strong hand on the steering wheel. Think of vitamin D like air in the tires. If the tires are flat, steering gets harder, you still need the driver, but you also need the tires working properly. A 2024 analysis from Nicolaus Copernicus University looked at dietary supplements and blood pressure in older adults. The researchers found vitamin D performed better than placebo for both systolic and diastolic blood pressure, but they also stressed something important. Vitamin D has not shown the same benefit in the general population. In other words, not everybody gets the same result. That should actually make you trust this more, not less. Why? Because real science is honest. It doesn't promise a miracle to everyone. It tells you who may benefit the most. Older adults, people with elevated pressure, people with obesity, people with low vitamin D levels. That is a very different message from everyone should take this forever. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. Now, if you are already on blood pressure medication, this is where you need to pay attention. Track your numbers at home, use the same chair, rest for 5 minutes first, keep your feet flat, don't cross your legs, take 2 readings 1 minute apart, do that at the same time each day for 1 to 2 weeks after any change in diet or supplements. Why? Because your body responds to patterns, not one random Tuesday reading. If your blood pressure starts dropping, that can be good news, but it also means your doctor may need to review your medication. Not because vitamins are better than meds, but because your total plan may be working better. That's what you want. Lower pressure, fewer surprises, more control. But wait until you see number 1. I'd love to hear your story. What made you click on this video today? Share in the comments. Number 1, the biggest mistake is using vitamin D without a plan. Most people think taking the vitamin is the hard part, but actually the hard part is doing it in a way that is safe, simple, and trackable. A capsule with no plan is just another bottle in the cabinet. A 2022 study from the Medical University of RAAS followed 200 patients with hypertension and low vitamin D. The study did not find a clear overall treatment effect on 24-hour blood pressure after supplementation, but it did show something useful. People who achieved higher vitamin D levels tended to have lower 24-hour systolic pressure, while very low achieved levels were linked with higher readings. This tells you success is not just about swallowing a pill, it's about actually correcting a low status and then measuring what happens. So your plan needs 4 parts: a blood test, a daily intake target, home blood pressure tracking, and a follow-up check. That's how you turn hope into information. Doesn't that feel a lot better than guessing? And let me add one more point. Food still matters even if you take a supplement. A supplement is not a free pass to skip meals, stay inside all day, and ignore sleep. Blood pressure is like a four-legged table. Vitamin D can help one leg, but you still need the others: movement, sleep, stress control, and a diet that doesn't drown you in ultra-processed food. Let's pump the brakes for a second, because even good things can go wrong when you use them carelessly. I'm not saying this to scare you, but vitamin D can interact with your health situation. If you have kidney disease, high calcium, parathyroid problems, a history of kidney stones, or certain heart rhythm issues, you need medical guidance before taking higher dose supplements. Some medicines can also change the picture, including some steroids, weight loss drugs that affect fat absorption, and certain seizure medicines. Too much vitamin D can raise calcium levels, and when calcium gets too high, you may feel weak, nauseated, constipated, confused, or extremely thirsty. In more serious cases, it can stress the kidney, so please don't take 5 different products because one influencer told you more is better. It usually isn't. You should also talk to your doctor right away if your blood pressure stays above 180 over 120, if you get chest pain, severe headache, shortness of breath, weakness on one side, or confusion. That is not supplement territory, that is urgent care territory. So you're convinced but thinking, how do I actually do this? Start with the simplest option first. Get your blood pressure checked correctly at home for 1 week. Write it down. Then ask for a vitamin D blood test at your next appointment. If you already know you are low, use the safest routine possible. Aim for regular food sources. Consider a basic supplement only if your doctor agrees. Take it with a meal. Recheck later. If money is tight, focus on the budget-friendly choices: fortified milk or plant milk, eggs, canned tuna, canned sardines, fortified cereal, a short walk in daylight. You do not need an expensive heart health bundle. You need habits you can repeat. If you want the easiest daily routine, try this: breakfast with fortified milk and eggs. 10 to 20 minutes outside if you can. 1 fish meal a few times a week. 1 supplement, not 3 if it fits your plan. Blood pressure logged by the same chair every morning. That's it. Simple. Boring? Effective? Look, there's a lot of noise out there, a lot of promises, a lot of miracle talk, but the truth is usually much simpler. Vitamin D is not magic. It is not a replacement for your doctor. It is not a reason to stop your medication on your own. But if you are low in it, especially after 60, fixing that deficiency may help your blood vessels work better and may help bring your blood pressure down in a meaningful way. You don't need to overthink this. Start with just checking your level and tightening up your routine. Your body will tell you if it's working through steadier readings, better consistency, and fewer surprises. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong.